Hey guys, Dr. Ray Marque here for our latest episode of Dr. Ray TV. What I try to do on these episodes is just talk a little bit about some of the interesting cases that I see, and maybe something affects you or a family member, so maybe it helps someone out there. So there's a condition out there called frozen shoulder syndrome, and over the years I've seen more and more of it, and I think I'm seeing more and more of it because I've been able to do a pretty good job about helping people with it. So the big name for frozen shoulder syndrome is adhesive capsulitis, and there's quite a few people get it, and I'm not sure why. So because there's no one thing that brings it on. So what is it in the first place? Well, frozen shoulder syndrome is a condition where the patient slowly loses motion in their shoulder. It freezes or it locks up. It can be very painful, or it can be no pain at all, where it just doesn't move. It can be from a chronic condition, or it can be from an acute injury. So let's talk about that first. So when are the times that we see frozen shoulder syndrome or adhesive capsulitis? Well, sometimes I see it when patients have had shoulder surgery, so maybe a rotator cuff repair or labral tear or something, and they had it repaired, and they don't do the physical therapy that they were supposed to after. So they had a surgery, didn't follow through with the physical therapy like they should have, and it slowly freezes up. So why is it freezing up? Well, they think that the capsule around the arm joint or the shoulder joint tightens up, and when it tightens up, it doesn't allow the arm to move. They're not really sure why it happens, but it does. And then when it tightens up, all of the surrounding muscles, so the trapezius, or this big muscle on your neck, your shoulders, your back muscles, they begin to freeze or tighten up, and the whole shoulder slowly loses more and more motion and can be very painful at times. It seems that most patients get to me when it's already at the point where they can't even comb their hair. They have difficulty reaching behind their back to get their wallet out, and I'm not sure why people let it go that far. So, and I guess I'll give a piece of advice right in there. If you start to feel this or you think you're getting it, I want you to get checked out right away and not let it get to that point. So again, we've seen it with people that have shoulder surgery and then didn't follow through with their physical therapy. I've seen it with injuries. So I've seen some football players that tackle people and they kind of injure that AC joint, and that comes in that way. I've seen it from people that lift in the gym, too much repetitiveness of the exercises they're doing. They injure it and they continue to work through it. We've seen it then. And then the hardest part is, like the patient I saw today, there's no reason for it. They can't figure out what's bringing it on. And I do have a few ideas why, but there's no one specific thing. So the patient today didn't have shoulder surgery. She didn't injure it, didn't do anything repetitive wise, and it's still starting to freeze up. Thankfully, she came to see me at the beginning stages of it. She's just now losing a little bit of range of motion, and it's being painful. So what do we do about it? So if you have this syndrome or you have your shoulder not working right, what do we need to do? Well, number one, I got to make sure that there's not any pathology. Let's make sure that there's no new injury, no muscle tears, no ligament tears, no labral tears, no issues with the neck, no issues with the upper back, and make sure that we don't have something that we need to get you to the orthopedic to fix. So if there's no tears, rips, something broken that an orthopedic can fix, then we need to start working on it. And how we work on it is by doing some myofascial release. So what is myofascial release? Myofascial release is a condition or a treatment that we put pressure on the muscles and we work them out, and we loosen up the trigger points, we loosen up the knots, and we allow for more range of motion. It can be a little painful at times. Some people think it feels like a really strong deep tissue massage, but we're doing very specific to very specific muscles, bringing the arm and the shoulder to ranges of motion to break up adhesions, to break up collagen buildup, which is kind of like a scar tissue buildup that builds up in the joint and in the muscles. The problem with this type of therapy is that it may take just a little while, and it is painful. Okay, it's not the most fun thing to do. The knots that we're pushing on, the joint that we're trying to move is painful, and sometimes it's hard for the patients to go through it. But it's kind of a necessary evil to get you there. That's why this condition many times is very is a great condition to work with multiple doctors. So when I treat patients with frozen shoulder, I often refer them out to a medical doctor, because in the conjunction with appropriate medication to keep the pain levels down. Hold on one second. I keep on getting hey Charles, what's going on, buddy? So back scratches. That's funny. All right, guys. So all right, I'm back to the schedule here. What do we do? Back to frozen shoulder. So along with my myofascial release, along with our extremity adjustments, along with working on that shoulder, in conjunction with working with a medical professional, whether it's an orthopedic, your primary, or even a pain management doctor, the medication along with the therapy helps us get better faster. What else here? Okay. Here's the thing. This can take a little while, and I always recommend probably 2 to 4 weeks of therapy on it to try to get that shoulder to go back. If it doesn't begin to come back, or it's too painful for you, the next thing that we're going to do is get you to an orthopedic, make sure that there's no problems there. If there's no problems there, I do a procedure called manipulation under anesthesia, where we're going to put you to sleep for a little while, about 15 or 20 minutes. I'm going to put your arm through an aggressive range of motion, break up adhesions in the muscles and in the joints to unlock that joint or to unfreeze that joint. Again, it's called manipulation under anesthesia for a shoulder. Very high success rate with it. I've done tons of them, and I think just about everyone, we got all the ranges of motion back. So again, frozen shoulder syndrome, I know that's a little hard for me to say once in a while. First thing to do is come in and get it checked out as quickly as possible. Next thing to do is make sure that we don't have any pathology, meaning a tear or something broken. The next thing is to go through a series of therapy on it in conjunction with evaluation from a medical doctor. If that doesn't work, we switch over to manipulation under anesthesia. All right, I know that talk is just a little bit different than my typical neck and back pain, but I do see quite a few cases there, so maybe that'll help someone. Let me see if I can't answer a few questions. I'm a little new to this live stuff. What about spinal stenosis? Do we treat spinal stenosis? And hey, Janet. We do treat spinal stenosis, and it's not so much that I treat the spinal stenosis. Spinal stenosis is a byproduct of degenerative joint disease or disc disease. So your vertebral joints have degenerated, put pressure on the disc. The disc has pushed back or herniated towards the spinal cord, and that's causing the stenosis part. So what do we do about that? Well, what we need to do is try to take the pressure off the joint and possibly allow that disc to pull back a little bit so you don't have as much of the stenosis. So stenosis is just narrowing of the spinal cord. There's not enough, the hole where the spinal cord is in gets smaller and doesn't have enough room for the spinal cord. It can be a very difficult condition to get better. The way that I approach it is really kind of the same way. Number one, we may attempt spinal manipulations if it's appropriate for you. If we can't do a manual manipulation, then we would go in there and do instrument adjusting. We would do some myofascial work to loosen everything up. Hey Joe, how's it going, buddy? We would do some muscle work in there to try to loosen things up and hopefully relieve some of the pressure on that joint for the spinal stenosis part. Hey Donna, how are things? This is kind of neat. Everyone can kind of put the little thumbs up. All right, guys. Well, look, it is just about 6 o'clock. It's time for me to get out of here and go grab something to eat. I hope everyone is well. If anyone has any questions about anything I've ever talked about, if I can answer it, I will. So just shoot me a message on Facebook and we'll talk about it. Everyone have a great weekend. Bye-bye.